So, welcome to Benita's Maternity Program webinar. Today we've got sister and midwife Ingrid Groenewald who will be speaking to us about breastfeeding and how to deal with certain breastfeeding problems that you may experience during your journey. So, welcome, Sister Ingrid, and the floor is all yours.
Thank you very much. It's such an honor to be with you today and to also have all these pregnant moms with us today. Because really breastfeeding is such a topic that's so dear to my heart. I have also done all sorts of courses and also the International Board Certified Lactation Consultant course, with breastfeeding, and ever since been very much involved also not just with the midwifery but also with the breastfeeding part of having a baby. And also, so today I'm going to talk to you about the most common problems that people experience and really how to get around it, because I find that a lot of people don't have the support. So depending on where you live, you might not have somebody close by. So hopefully today this is going to just be a little bit of a help. You might already have your baby and you're struggling, or you are pregnant and exciting to your breastfeeding journey that's ahead of you. So hopefully that's going to help. So the first thing that I find with breastfeeding is that some people say that immediately after birth, it's really difficult to get the baby to latch. It's almost like the baby's not interested. So obviously we're talking about the problems, not the normal things now. Most babies, once you put baby onto the breast, they actually just start feeding, but you have sometimes a situation where a baby is just not interested, and it might even be that what happened at birth. Perhaps you had all sorts of medications given, pain relief injections, or anything that was given to you, and that obviously can affect the baby. We know babies are not as awake sometimes, depending on when it's been given to you as well. So what to do if you have a situation where baby is placed on your chest and it's just so difficult to get this baby to latch. So I want to introduce you to my little baby, which is Erica. Her name is Erica. She's been with me ever since I was about 6 years old. So she's still with me. So she's obviously well behaved. So let's say baby Erica was now born, and she is just very what's the right word, sleepy, and she does not want to be fed. And we all know that can sometimes cause all sorts of problems or stresses, not just for the mom, but also for the nursing staff and the midwifery staff where you are. We want the baby to start feeding within the first hour. So the ideal is that baby is placed on your chest naked at birth. Obviously Erica is now fully dressed, but you place your baby on your chest, skin to skin at birth, and baby should be left there. That on its own is already a good step in the right direction to have a good feed and a good breastfeeding path ahead, because that skin to skin causes a lot of good things, not just with the mom, but also with baby. So if baby's placed skin to skin on you like this is going to help also to calm baby, and then also lots of hormonal things are happening and also instinctive behaviors. So what to do if you have your baby on your chest and baby's not feeding? I would actually say undress your baby. If your baby's already dressed, perhaps it's a couple of days later, undress your baby just into a nappy, lie in bed, put your baby on your chest, skin to skin, and now you can put like a duvet or a blanket or something over you and sleep like this and rest like this for as much as you can. This position is very close to the breast, so this baby actually smells your milk, so it's very much in that environment. So often babies suddenly realize that, hang on, something really is here that is quite nice, and baby wants to actually feed. So first of all, the first thing would be have your baby skin to skin for as much as you can. Then the next thing is that if baby is definitely not feeding, and we know that we want babies to feed, so what to do then is by taking, I just want to show you again, this is now another breast. Obviously, this is my third breast, I can actually say, and how to actually express breast milk. And remember that breast milk initially, the colostrum, the first milk that baby's getting, it's called colostrum, and it's highly concentrated. Baby does not need a lot. if you can give every now and then a little bit of a couple of drops, so let's say if you have a teaspoon, use a plastic teaspoon, and if you can express, let's say, half a teaspoon to a teaspoonful of breast milk on there and give it to the baby in the mouth, you know that the blood sugar will be fine with the baby. So there is no stress. That is quite normal to do that. So you can take a teaspoon and express by, and I'm going to show you now, on the teaspoon and then into the baby's mouth. If you do that every 2 to 3 hours, it allows the baby time to just wake up properly and be more responsive, and then to feed better. You don't have to stress about babies not getting any milk in. Okay, so that normally the skin to skin and the expressing, and by giving that into the baby. Very often, if you give this milk to the baby, it's almost like this baby wakes up and thinks, hang on, there's something that's really nice and I want some more of that. And then suddenly these babies actually latch much better. So how you express is you put your middle finger and your thumb on either side of the areola. So this is the nipple part. The areola part is the colored area around the nipple. And so you put your thumb and your middle finger on either side. And obviously I'm maneuvering this that you can see properly. But so if I turn it to the side, you're going to see what you then do is you take these two fingers and you push back towards the spine, and then it's towards one another and then to the front. So it's to the back, towards one another, to the front. Okay, so if you keep doing this, and just and slow to the front and to the nipple, you're going to see there's a drop of colostrum, and you catch it in a little teaspoon, and you just keep doing this, and then you different areas, so it's not just on the same spot, but you go all around, and then that goes into the teaspoon, and then you can just basically give this to your baby. And like I said before, you know your baby's getting breast milk. It's highly concentrated. We know for a fact that about 5 mils, so a teaspoonful of this milk, equals about 30 mils of the later mature milk. So you are doing fantastic if you can just do that, and you know your baby's getting milk. And then suddenly baby's going to wake up at some point and then start to feed. Okay, so this is in the first couple of days after birth. So now baby suddenly woke up, started to feed quite a bit. And that is another thing that I see sometimes, that people become really worried because it's like almost like this baby wants to feed all the time suddenly. So all this, the idea of every 3 to 4 hours that people have heard before suddenly is out of their window because your baby wants to be on the boob the whole time. And now, first of all, I have to ask you, if you think at this point, if you are still pregnant, how often is your baby feeding currently? And the answer there is that your baby is feeding all the time. The baby's getting food every second of the whole time. Your baby's actually getting food. So it's quite a new thing for a baby to be born and to wait for the next feed. So that's why it's quite normal for a baby to wanting to feed all the time. So if baby's awake, if the eyes open, you know your baby's hungry, even if it's half an hour ago or an hour ago that the baby actually fed. That's the ideal time to put baby on the breast again. Also, if you think that the first 3 days after birth, your breasts are quite soft still, so it's quite soft, so it's much easier for the baby to latch on compared to a baby or a breast that is now already after 3-4 days where the engorgement sets in, and we're going to talk about that. Then it's a lot harder, and then sometimes babies really struggle to feed. So what you want is to feed often in the first 3 days so that you can learn how to hold, your baby learns how to latch, and that it's just a big learning curve for everyone. And then 3 days later, if the mature milk comes in and the volume increases, then suddenly it's not a big thing anymore because everybody has now learned also exactly how to do this. Okay, so so it is not a problem if baby wants to feed often. At this point, I usually say to people, take away like your watch that you're wearing, take it off, put it somewhere in the cupboard. If you've got a clock or somewhere against the wall, take it off, put it in the cupboard. Unfortunately, we can't take the time off our cell phone. If one could do that, I would say do that, because one of the biggest problems that I see with people, it's usually time related, because people perceive it as a problem and it's not really always a problem. Okay, so if you don't know the time, you just look at your baby to see if your baby's hungry or not. Okay, if baby wakes up, usually in the newborn stage, you know your baby's hungry, so then baby's still calm and you can actually so much easier latch the baby. Okay, so now because this baby is feeding so often, okay, so every hour, every 2 hours, this baby is feeding, and we know it's quite normal to breastfeed 8 to 12 times in 24 hours. That is about the normal average rate. So if a baby feeds, let's say 2 hourly, and that is now from the beginning of a feed to the next beginning of a feed, you might experience that suddenly it starts to become quite uncomfortable if the baby latches on. So that is also that from all the problems that I see and deal with, this is one of the most common problems that people have in their breastfeeding time, because it becomes really painful, that the nipples can get really painful. Some people experience bleeding, some people have blisters or cracked nipples. Now, first of all, I have to also just point out here that if there's pain involved, something's wrong. It does not have to be painful. I find sometimes people think that it must be painful. Breastfeeding is a painful thing. It is not. Okay, if there's pain, there's usually a problem. And how to deal with this is, the first thing to look at is to what happens? Why is it painful? And usually it's a positional thing. And the positional thing, if I can just show you with the baby, is that you have to turn the baby to the side. Okay, so baby's tummy has to be on your tummy. So not lying on the side, you know, on the back, and baby has to turn the head. That makes for the nipple to stretch, okay, and that's going to be painful. So you have to turn the whole baby so that baby faces you, touches you, and then you can actually feed. Okay, so that the position thing is usually the best answer to try to just get the feed better or the actual latch better. Another thing here is with painful nipples that is really important to understand is that the nipple should not just be in the entrance of the mouth of the baby. This is often something that happens, is that babies are positioned. Obviously, I can't unscrew my boob, but I'm just going to show you in this position. Most people position their babies that the mouth of the baby is right here where the nipple is. And this is a cause of concern, because here what will happen is that the baby's just going to open the mouth a little bit and then just grab the nipple. And then often it's perhaps where you think, oh, you know, at least my baby's feeding a little bit, you know, and then you sit still. And even though it feels uncomfortable, you think, okay, now just sit still. Next feed, it happens again. And then you start to sit really straight, you know, straight. And then after that, it becomes really painful that people feel that they can't do it anymore. So from the beginning, it has to be that you actually aim the nose. Look at the nose. Where's your baby's nose? Aim that at the nipple so that the baby has to look up, first of all, and then also she's going to smell, hang on, there's milk here, and the rooting reflex is going to go. And then if you start seeing the mouth is starting to open, then you can just slide the baby over. That basically means that if you have the nose here, the mouth here, and once you slide baby open, you know, over, it actually causes for a bigger latch. So you want the baby to latch much better, you know, a wider gap, you know, the mouth that actually goes over, and this immediately is going to feel better. Baby's not nipple feeding, baby's breastfeeding. This is by far the most common problem, is that people stop, you know, have pain involved, and this is also the reason why a lot of people stop breastfeeding, because they think they can't deal with the problem. So let's assume you already have painful nipples, and okay, you're going to get this latch right now, but now it's really still painful. How to get the pain better? And this is what would be to try to ventilate. Look at your setting. Perhaps you can open the curtains, get the sun coming in. I don't know what your neighbor, how it looks outside, but if you can have the sun coming in, and then take off your shirt, take off your bra frequently in the day. Okay, you want some air, you want some fresh air, you want some sunlight on the breast on a frequent basis. Do not sit in the sun out too long that you actually get sunburn, okay, but just be in the sun for the healing purposes of the sun itself. So that definitely helps a lot. Let's say 5 to 10 minutes at a go, and then you can just see how that feels. So, and also when you're breastfeeding your baby, so let's say I'm breastfeeding on this side, we tend to only open one side and feed baby, and then once we're done, we close again. But it helps to say, well, when you're home, take off the shirt, take off the bra, so that when you're feeding on the one side, that the other side is actually open. It actually gets some fresh air. You might need to take a towel or a spuugdoek and just put this over your baby, because this side is going to drip. And this is actually good, because we know breast milk actually has a lot of healing properties. It's all living cells. It's all medicine on tap, really. And you can even put that on the nipple that is now painful. So feed on one side, other side actually gets some air. When you feed on the other side, this side gets some air. So that, together with being outside or being inside but getting sun on, that will definitely help a lot to improve that. You don't have to use all sorts of expensive creams and so on if you can't afford that. You can. There are some really good ones on the market, and it might be a good idea to talk to your midwife or your lactation consultant about it. But otherwise, just by taking a little bit of the breast milk, and you can you can basically just put that on after feed, sit for a little bit that it can just dry, and then put your clothes on. Obviously the ideal would actually be try to not put clothes on, but in reality that's not always possible. You might have visitors and people in the house which might not be the best to just walk around topless. But if you can, for as much as you can, and sun is really good. So that is with the painful nipples and the bleeding nipples. The next thing that I would say is engorgement. That is another problem that people sometimes experience, and that happens on day 3, day 4. Remember earlier I said on the first 3 days, the breast is still very soft, so baby learns how to feed. It's easier to feed. If a baby now suddenly starts sleeping for longer stretches, on day 3, day 4, what happens is that the milk, the volume of breast milk actually increases to quite a bit. It's, let's say, 120 mils more or less in 24 hours for the colostrum, which sounds quite little, but it is quite normal for a newborn baby. And that suddenly goes overnight to 500-600 mils, and that suddenly causes the breast to really fill up quite a lot. And so the longer the baby sleeps between feeds, the longer your breasts have time to really fill up and become uncomfortable. So the best thing here, I would say, that once you start noticing, oh, my boobs are starting to fill up on day 3-ish, somewhere there, that's the time you start waking your baby. So every 2 hours, day and night, if you notice your baby, is just moving, just take the baby and feed baby. That is just for a very short space of time. It might just be a day or perhaps 2 days. It's just to settle that. Because if your baby sleeps now for 4 hours or so, your breasts have time for 4 hours to really fill up, and sometimes it's really hard. And if it's so swollen, the nipple actually pulls in, and then it's very difficult to actually latch properly. So you want to keep it as soft as possible, and that would be by feeding often, okay? But let's say baby just fed, this little tummy is full of breast milk, so you cannot wake this baby anymore. Baby is really very full, and you still feel really uncomfortable. What to do? And this is again where the expressing would come in. You would open the curtains, sit where you actually get full sun, where you heat really nicely, you warm up, or at night time you can get into a bath, really warm water, so your core temperature goes up. And what happens then is that it's so much easier to express, and more milk will come out. And it's not to say how much milk comes out, it's more what is comfortable for you. So if you express, it can be 10 mils, it can be 50 mils, it doesn't matter. Up to the point where you can say, okay, now my boobs feel softer, it feels comfortable now, I can wait for another hour. And then perhaps in an hour's time, I'd start to just try to maneuver your baby, undress your baby, change the nappy, try to see, can you wake up for another feed, And this is for a short space of time. This is really just for a day, max 2 days. If you do that, you never get to this extreme, uncomfortable, full, swollen breast where it feels you can't touch. Okay, now if that is the case, what the problem there is that it can go into mastitis, and what that it basically means, it's infection of the breast tissue. So the milk that is in the ducts actually suddenly doesn't know where to go anymore, and it actually pushes out into the tissue itself of the breast, and then you have a really red, angry looking breast, and it's really painful. Moms with mastitis feel terrible. They feel like flu, that they've got flu, hot and cold, fever, and it's really painful. The best thing here again is by feed all the time. Your baby's protected. Don't worry about infection with baby and so on. Just keep feeding your baby. Often take off the clothes, feed. And then if baby can't feed, just express by hand and sit in the sun. And then if it doesn't get better, it might be important that you see a doctor, because sometimes it is medication that's necessary, but it does not mean that you should stop breastfeeding. That is quite important to know. There are very few instances where it actually is the reason to stop breastfeeding. With most things, you can actually continue. And with medication, there's always something that can be given to you, which is safe for baby. Okay, so that is really with the engorgement and mastitis. And we actually don't have a lot of time, you know, with this talk. I can go on for days with all these things. But yes, these are the most common problems, is the baby will not latch initially, painful nipples, bleeding nipples, things like that. And then also, you know, with the engorgement and mastitis, that often happens. Something that I also just want to add here, perhaps before we open this chat box so that you can actually start asking questions, is that some people say, it feels to me like I don't have enough milk, or that my milk is not strong enough. You know, that is something that you often hear. And it's something that cannot happen. If you think that what happens in the milk, that is what is in the milk, it's exactly right for the baby, okay, with the you know, all the content, basically, if I can explain it like that, okay. If you normally, if I ask, okay, so why do you think your milk is too weak? If they say often it looks like water, and yes, some of the milk needs to look like water. If you express a bit and you put it in a glass and you look at it, the initial milk is a very watery color. It's a see-through bluish color, and that is also quite normal, because that is the full milk, or that is the watery part of the milk that baby needs to get for thirst. If the baby feeds longer, or if you express after the feed, you're going to see that the milk actually is a lot whiter. Okay, and that is really the content, where it's really the nutrition that is in there. So don't stress as to what the milk looks like, you know. I find sometimes people think that baby has to be sleeping for a certain amount of hours, and anything before that, if your baby wakes up, they think that there's something wrong. This is normal behavior for a newborn. And even in a couple of weeks in, couple of months in, that some babies just like to feed every hour, every 2 hours. If you think about yourself, perhaps by thinking about today, how often have you put something in your mouth? You know, so it might have been tea or coffee this morning, and then you had your porridge and you had a snack of water, and perhaps you're sitting here drinking water or juice or something. You know, we constantly put something in our mouths. Why do we expect our babies to actually then stretch for 4 or 5 hours? This is not normal behavior for babies. They want to feed often, and that is quite a normal thing. Sometimes you will see baby feeds for a short time, your baby was just thirsty at the time, and sometimes your baby is hungry, and then your baby's going to feed a lot longer. So I hope that makes sense. If anything does not make sense, or you don't understand, or you need more help, and perhaps you've got other issues, definitely there are in South Africa quite a few lactation consultants, and you can go online and you can find them, or looking in your area, who are the people who are able to assist and help you, because it's so worthwhile. If you think of to what you are giving your baby, it's all liquid gold, really. It's all living cells. It's all to do with building immunity and so on. and it's really worthwhile in just sticking through. Hopefully, if you have painful nipples, that you can adjust the position, look at the latch, and do all these, exposure to sun and so on, that you can actually just feel better. Because usually there's a turning point and then suddenly it starts feeling better. So I hope that makes sense. So what we can do now is to actually open the chat box, Liana, that we can just see if there are any questions that come through. We can just deal with the questions as well.
Perfect. You can type the questions in the box and we will answer them.
Yeah, sorry, I forgot to tell you that there's a chat box. Just write your question there, and then we can see and basically just deal with the questions. I cannot see the chat box, by the way.
I will read them to you, no problem.
Okay, perfect. While we're waiting for some questions, also what you can do for painful nipples, it's also obviously the sun, sitting in the sun, ventilation, but you can also get, it's like a little dome that you can buy, and you can even make your own Tupperware. I have seen people with also going to the kitchen and finding any kind of container that you can place over the breast like this, over the nipple, because then the nipple doesn't touch anything, and that you can wear over or inside your bra, and the bra actually keeps that in place. Obviously the ones that you buy the design is quite nice because it's round and it's nicely, but you might just have something in the kitchen that you can use. Just think about outside the box, and you can actually put that over, and then between feeds, the nipple is not touching and there's no friction, because that often hurts, with a bra that is basically constantly the friction of that. So that often helps to resolve that. Okay, I see here a question: how does pumping work for working mommies? Okay, that is definitely a big concern for moms that need to go back to work later on. And some are perhaps sooner, some at 2-3 months go back, and others are perhaps lucky for 5-6 months to be at home. But definitely pumping then is a fantastic thing to continue breastfeeding. I wouldn't say that if you're still pregnant that you have to buy breast pumps and things at this point. It's something that you can later on, getting closer to going back to work, that is the time you can actually start looking into that and seeing in your situation what works best. But usually about a month before you go back to work, that is the ideal time to really start looking at your situation. Are you able to come back to your baby at feeding time or lunchtime, or are you very far away, or perhaps your baby is with you or even in the same office than you? So that is why, every person's situation is different. But if your baby is not with you and is taking care somewhere else and you are away from your baby, you need to express to be able to keep the milk flow going as well, because we know that is really where the milk flow, the stimulation is important to keep the volume of milk. So you would need to express like the baby would feed at that time, normally if you would be at home. So usually babies are slightly older, so it's not a newborn. So you would need to sometimes, you feed just before you go to work. You express perhaps once or twice in the morning, depending on how your baby normally feeds. And then at lunchtime, you can possibly come back, to the baby, or then you would express again. So every 3 to 4 hours, depending on how your baby normally feeds, you would express. And that milk you can basically keep to give to the caregiver, the following day for those feeds. And usually that milk is enough for that day. It is, however, a good idea to start expressing beforehand, to start building up a stash at home. And you can express, usually most moms find in the mornings, if you express in the mornings, that you can get so much more. Some moms find you breastfeed on one side and you express on the other, and then that you basically freeze. And there are different ways of freezing. We get all these little nice little freezer bags, containers, and so on, that you can actually use to freeze the milk in. Or you can use little containers like ice cube containers. And again, this is perhaps a question where you can also talk to your lactation consultant close to you as to all the ins and outs. But then this milk is then kept as a backup. So if the milk that you've been expressing in the day at work is not enough, or your baby vomited, that you can say, okay, it's not the end of the world, I still have more milk. It's just really important that the person who takes care of your baby has to be educated as to how to handle breast milk. It's not something that you pop into the microwave if you're in a hurry to warm. Room temperature is fine, or just by putting it in a little bowl of warm water, and not to boil it on the stove. Remember, it's all living cells. Even if it was frozen, it is all, most of it is still there. It's still alive. It's still good for your baby. Do not kill it by putting it in the microwave. I hope that makes sense for the working mommies.
We do have another 2 questions, and one is, do you need to alternate between left and right every time and be strict about it? Or if you skip right once here and there, would it be okay?
Okay, so that's a good question. So I would say for the first bit, if you have a newborn and your baby, and you're still also learning how to feed, so then you basically feed on the one side for you latch your baby, you look at all these things that baby is correctly latched on. So baby starts to feed. Here, again, do not look at the time. It can be 10 minutes, it can be 50 minutes, it doesn't matter. Baby perhaps actively feeds. You see your baby sucking. The baby will stop at every now and then to just relax a bit. Eyes are closed later on, that you think is your baby sleeping. And just when you think you take your baby off, then suddenly baby starts feeding again. And that is good. Okay, so baby's feeding. So once you see that the baby actually let go, the latch is broken, the mouth is open, you take your baby off. You can burp your baby like this, or however in position you want to burp your baby. That's a topic of a whole different how to do that. But then once baby is burped and ready, then you can latch baby on again on the second side or the other side. Obviously, this side, the baby will not feed for the same time than the first time, because baby's already almost full on this side. So whenever baby's done on this side, you finish, you burp baby again, and you can put your baby down to sleep. Next time, you just feel what side feels the fullest, and very likely this side is going to feel the fullest because baby didn't feed long on this side, and then you start on this side. So normally, just to get things going, I would say try to do both, and just remember, or just feel what is the fullest side, and then you start on that side. Later on, it's not a problem. A lot of moms do feed on one side only with one feed and then the other side. But again, if you just think about the logistics here, the milk volume of how much milk you make is 100% stimulation related. So the more you stimulate, the more milk you make. And this is how you can up the volume or down the volume, okay? And usually we want up the volume, okay, for most moms. So what you need to do is to think that if you feed on this side and your baby's now sleeping for, let's say, 3 hours, okay, and then after 3 hours, baby's hungry and you feed on this side, it's another 3 hours and then it's this side. So it actually means that this side has a very long break between feeds, and that is what you want to avoid initially, okay, just to set up the hormones, set up a good breastfeeding beginning. Later on, you will see how it feels to you, and at any point, if you feel, no, it feels like my milk volume is it's going down, it doesn't feel that full anymore, then I would say, then just make sure to alternate and to potentially even feed more frequently. Wake your baby, because that will up the breast milk again.
Perfect. Another question, there's quite a few actually, so we'll get through them. Is there any preparation one needs to make on your nipples in preparation for breastfeeding?
Yeah, in the past, I had some horror stories where people used to hear that they have to use a little brush and put spirits on, and then by really scrubbing, it's really horrific. Luckily, we are enlightened. We have the research behind us to say, that is really bad practice. We need all these nerve endings properly working, that will tell your brain that baby is feeding. So normally in pregnancy, you don't have to do anything. It's the pregnancy hormones that really prepare the breast for breastfeeding. If you want to do something, you can potentially sit in the sun every now and then, open, just tanning a bit, that you can do. But I wouldn't say do some specifics. You don't need to put any kind of creams or anything on. Some moms find that they will have already a drop or two of breast milk that they will see, and other moms say, I've never seen it, and it doesn't mean anything. It's just that some people see it and some people don't. So in pregnancy, don't stress too much.
Okay, another one. If you're planning to go through a C-section, how is skin to skin with baby affected, and how can you make it better?
Okay, so if you have a cesarean and you know that it's a scheduled cesarean, it might be a good idea to ask these questions before you go in, because hospitals all differ. Some hospitals are very involved already with the baby friendly initiative, where it basically means that everything that's been done is in the best interest of mom and baby, that is evidence-based. Some hospitals just take their time to get there, and hopefully in future all the hospitals will be there. So it might be something to find out what happens at the Caesar. So the ideal obviously would be that if baby is born and checked and then given to you while you're still in theatre, and baby then remains on your chest, and even skin to skin can start there. But I know it doesn't help me to tell you that is something that you need to do, and you perhaps go to a hospital where this is not going to happen. Ask these questions beforehand. Normally what would happen if that is not the case is that your baby might go to the maternity ward, and this is where the dad can go with the baby. Dad can do skin to skin while mommy is still in theatre. So undress, take off the shirt, baby on the chest of the father, and then baby can stay there until mom is back. I had some situations in the past where babies even latched onto the dads, which is quite funny. But that is just like an instinctive kind of behavior that baby actually does. But then once mom is back, so whenever you're back in the ward, that is then the ideal time that baby needs to come to you. Undress your baby. If somebody already dressed your baby, undress the baby, just the nappies, okay, to have baby on, and then place baby on the skin, for skin to skin for as long as possible. And then also that is the ideal time to start feeding, because we know the sucking reflex is the strongest within the first hour. So the longer you wait, the weaker it can become. Luckily, we don't do the incubators so much anymore. In the past, babies were placed in incubators for very long time periods after the birth, and then often these babies were very confused. They didn't know what to do with breastfeeding. But remember, if that is the case, that your baby's really confused, remember at the beginning that I said, lots of skin to skin, have baby in this position, baby smells the milk, you can express a little bit in a teaspoon, and just keep giving that to your baby if that is the case.
Great, thank you. Can I feed baby with a nipple shield on at the beginning stage?
Okay, Nipple Shield is something that is available. I would not say to start off. I find a lot of people, if you look at your nipple, some people have nipples that are quite prominent and you can see them. Some people it's flat, that it's barely visible, but there is a nipple, but it's not a long nipple. And then for some people, I can't actually do it with this one, but it's really inverted. Okay, now you have to remember that your baby's not nipple feeding. Your baby's breastfeeding. If you latch your baby correctly, that the mouth goes like over the whole area, that vacuum that is produced in the mouth actually can pull this nipple out. The skin cells are quite elastic of a nipple. If you pull your nipple, you can even try that after this. If you pull your nipple, it actually can get quite long. Sorry. So what you want is to actually latch the baby nicely. So I wouldn't say for the first beginning, do not use a nipple shield. If you do run into problems, I would again say contact your lactation consultant closest to you. There are a lot of hospitals who have on staff a lactation consultant who might come and help you. And if it's still the case that baby really struggles to latch, nipple shields can be used and can be used quite successfully. But I wouldn't just jump to it the first time one actually battles. It is definitely something that is available, that if one uses it, or that it is something that one can use. but often, you know, you might think you need it, and then it's just a surprise that this baby actually pulls this nipple out. And a lot of moms later on don't have inverted nipples anymore. You know, the nipples were inverted at the beginning, but with all the feeds, it actually helps these little ligaments and these little, it's almost like ropes, if I can explain it, that help, you know, that it holds it back. So it actually strengthens it, or it lengthens them, and then suddenly you have a nipple. Okay, so hopefully that explains that.
Great. So we have our last question. Should I take bottles to the hospital when I give birth, or will this cause nipple confusion as it's too soon for bottles?
Thank you very much for asking that question, because I have not included it in my earlier talk. Breastfeeding initially, to get it right, would mean you want to avoid anything in the mouth that can possibly cause a confusion. If you think the nipple of a bottle is quite long immediately, where the nipple of the breast in most moms is not the case, okay? And then also how the milk comes out in a bottle is very different to how the milk comes out and what the baby has to do with the tongue. So it is quite important, I would say, for the first bit, avoid the bottles. Do not take the bottles to hospital. I would actually go so far, if you haven't bought them, if you're still pregnant, do not buy bottles, okay? Leave that. You can always get that later if you need to. But for the beginning, do not buy them. If you already have them, keep them in the cupboard, okay? Do not take them to the hospital. And I would even say for a dummy, for the first 3-4 days, do not take the dummies to hospital, because again, it's a very long thing. What you want to encourage is a baby to feed on you frequently. So if your baby wakes up and is hungry and is searching, you want to take the baby and latch the baby and feed baby, because this is how your baby learns what to do. If from the beginning there is something that is quite a long thing that's been placed into the mouth, like if you think about a dummy, it's very, you know, your baby might suck it and enjoy it, and then the next time this baby is now hungry and you want to feed baby, and then sometimes babies become really irritated because they can't latch onto the nipple and onto the breast so nicely, because it's not the same to the dummy. So you want to avoid that, and to just basically feed your baby quite frequently. And once later on, you can look at bottles and things. Once you can say, okay, my baby's actually feeding nicely, I just take my baby and put my baby on, and then baby just starts and feeds really well. Then you know that is good. And before that, you avoid that. Okay. And then that is also a whole different talk of, you know, going back to work and what to put in the bottle and how to do this and so on. So I'm not going to go into that too much now. But for now, for the beginning, so if for the beginning purposes of you are now pregnant, you're getting your baby's just born, avoid that. Okay. And do not give that until you can say your baby feeds without any problem. Then you can start introducing expressed milk perhaps, but keep in mind, do not extend the time what happens with stimulation. You want the stimulation frequently. There's no point in expressing milk and giving it to baby in the middle of the night, somebody else, and now suddenly you sleep for how many hours? Your breasts, no, nothing happens for that time, and then the milk can go down. So you want to keep the stimulation up, so that you can frequent stimulation, so that the milk volume actually is good. And that's a good way to start this journey of the breastfeeding. And then you learn along the way, and you can change things along the way. Find in your place, wherever you are, find a person who can walk this, you know, this path with you. Who is your lactation consultant? Who's your midwife in your area? If you can't find someone online that can assist and can help you in this journey.
Okay, I think that also answered now another question that just popped up. I was told to introduce a bottle as soon as possible to allow easier transition to bottle when back to work.
Yeah, the same thing here. You know, it's just you don't want to introduce it too soon. I usually say for the first 4 weeks, do not give it, you know, but I won't say it has to be exactly 4 weeks. Babies are all different. So it's just that sometimes you might have a situation where baby becomes so irritated and doesn't know what to do. So if baby starts getting a lot of bottles, then suddenly this baby doesn't know how to actually latch onto the breast. So you want to first have this breastfeeding going well. And once that goes well, then you can start introducing the bottle with express breast milk. But here also, it shouldn't be the mom who gives it, because baby smells. If you hold your baby like this and you have now a bottle, your breasts are just here. It's very confusing. Your sense of smell of the baby is highly developed at birth. So if you hold your baby like this, your baby is wondering what the heck is going on, because the breast milk, first prize, is here. And now what is this thing? So that is why it's best that somebody else gives that, you know, that, for example, when you're popping out to town quickly or something, but keep stimulating frequently still while you're at home on maternity leave. Do not give a bottle and have hours and hours where nothing happens to the breast. This is if your baby's not feeding, you have to express. Okay, so either with a breast pump or by hand, just to keep the stimulation going, and then that milk you can basically freeze and just keep for later.
Okay, we got one more question. It's going to be our last question. We're going to close off. What if you are on chronic medication and your gynecologist tells you that you're not allowed to breastfeed? What do you do?
Okay, so here also, obviously I can't go against your caregiver, but this is where we have the internet, okay? And I know Google is definitely not the best, definitely. You know, sometimes it causes way more stress, but you can find your lactation consultant, give the medication, because one can actually get in detail reports with every medication. And I must say that most medications is actually fine. So there are only a few things that are not good with breastfeeding. And even there, you have to look at the risk and the benefits, you know, so it's not always a no. But for most conditions, obviously I don't know what the specific condition is there, but for most conditions, there's always medication that's safer for a mom with breastfeeding. It's also important here to note that it's actually very difficult for medication to get into the breast milk. A lot of the medication that you couldn't have in pregnancy, you know, because it's a lot easier to get through to the baby, through the placenta to the baby, that you couldn't take in breastfeed in pregnancy, suddenly becomes available to you. A lot of the times it's the case, because the molecules, there's quite, obviously it's quite in-depth thing, but a lot of times the molecules are just so big they can't actually fit through to get into the breast milk, you know. So it's a very different kind of way of how medication gets into, you know, to your baby while you already have your baby, compared to being pregnant. So I would definitely say, you know, get if you have a situation where you're not sure, your doctor told you not to breastfeed, try to find information on that, or find your lactation consultant again. That person would be able to give you a detailed report of all the medication, of the names of it, that you can do your own research. And then perhaps you can go back with your research to your doctor and say, listen, this is what the research says, this is what the study said, so many moms, this is what happened, you know, so that you want to, or no, you agree that you don't want to breastfeed, you know, with this. So it depends from situation to situation. And I would say just by doing your own research and making up your mind with the correct information.